And welcome back to the WHHI Daily News. Dr. Debi Lynes has joined us for her Mind Your Health segment on this beautiful sunny day in paradise. Paradise in May.
Absolutely, exactly.
And you know, we're talking about mental health today because mental health is really just as important as your physical health.
And May is Mental Health Awareness Month.
Yes.
And so people ask me all the time, well, I mean, what is mental health? And we were talking about it before we started.
Right.
And it's interesting because mental health by definition is your behavior, how you interact socially, your psychological well-being. Makes sense?
Is that moods? What about
Moods, and then your physical well-being. Because if I have a disease or I have an affliction of some sort, it affects surgery
injury,
when you had your
shoulder.
It affects your mental health.
Right.
So it's really mind, muscle, mouth, movement. It's all of those things put together, which is mental health. And what it is, it's mental health is not about disorder. Being well is about vitality. Okay, we want to feel good in these different domains, and I tell people all the time, 80% of the time, 20% of the time, our moods are like the weather. Okay.
Sunny, cloudy, sunny.
That's
cloudy.
exactly right. That's exactly right. And some days, like this past weekend, I was prepared for cloudy, and it was sunny. So we try to be flexible, okay, and adaptable in our moods, just like in the weather.
Okay, so Debi, if you're in a cloudy mood,
Yes.
you're not really depressed, not clinically depressed.
No, you're cloudy.
You're cloudy. How do you pull yourself out of it?
You don't. I think one of the first things you do is you acknowledge that I'm in a cloudy mood today. I'm sort of not feeling myself. I'm a little off.
Yeah.
What I do first is I say, halt. Am I hungry, angry, lonely, or tired? Ask yourself that.
Right.
Are you any of the above? If you are feeling cloudy and it's free floating, I bet you the answer is yes. Maybe I didn't get a good night's sleep. Maybe my husband's bugging me.
Right.
Maybe I ate too late, or I ate too little, or I ate too much. And I'm just feeling off. And rather than trying to stop it, if I acknowledge it, and then move on with my day.
Okay, so you acknowledge it and you say move on with your day, but let's say you just can't move on with your day. You get like maybe closed in and quiet and just like,
Is that a bad thing?
I don't know.
What if that's part of that cloudy day is instead of trying to make it okay, I just acknowledge it and radically accept it. And radical acceptance is sometimes things are just what they are. It is what it is.
There's certain things you can't control.
I hate that.
Right.
And well, it's funny because women,
want.
that's right. Moms, women in business, women in general, people in general want to feel like they have some control over their life. And we do have 100% control of how we react to everything. Okay. Right. Now, on a sunny day, I'm going to be cheerful and broad-minded. I'm going to be adaptive. I'm going to be just able to handle things. But your cloudy day, oh heck no. No. I'm going to be edgy and irritable and not very understanding. But that's not a bad or a good thing. You know, I think we tend to put moral judgments around these feelings that we have. I shouldn't feel this way. I'm so angry with my daughter. She didn't call me on my birthday. I'm pissed. I'm hurt. I'm everything. Okay.
Right. Yeah.
Is that a bad thing or a good thing? Well, I shouldn't feel that way. I mean, she's super, I love her.
And you put that kind of a guilt factor on yourself. And
it's that all or nothing thinking. I either love you or I hate you. You're either good or you're bad. You're neither. We try to hit the middle path. And so when we talk about mental health and what is mental health, it's coming to the middle path. It's seeking balance, both physically, emotionally, spiritually, mentally, and in your behavior.
Right. And at the end of the day, maybe it's just taking a walk, getting some exercise,
Putting your
talking it out with a friend.
That's it. Putting your fluffy robe on and watching a movie.
Right. Thank you, Debi. Always good advice. Good tips for your Mind Your Health segment. Thank you so much, and we'll be right back with more news.